Yeah, now I can see that we are live on Facebook.
Yes, we are. Okay, yes, we are live on Facebook, and right now I'm sharing it to the group. All right,
Here we go.
here we go. Welcome everyone to this live, and today we will be talking about PTSD and trauma, and we will explain what is trauma and what's the difference between trauma and PTSD. And we have one of the best people I have met recently. We have Letizia Spoto. Letizia, you're Italian, right?
Yeah, I am Italian,
Yeah.
yes. You will hear from my accent very soon.
And Letizia is a trauma-informed professional and something called TRE. I believe it stands for Trauma Tension Release Exercises, correct?
Perfect, yes, correct.
Yes. And also Letizia has worked with people who were addicts, if I may say. And you worked as well with adults. You worked with the children. Yeah.
No, with children, no, but young people, yes. So like
Yes.
teenagers that age, yes, children not. No, because
Okay.
mainly I was working in this addiction treatment center, and I was in the holistic and clinical departments related to trauma. So they were coming to me, they were doing their program regarding addiction, and then they were coming after into my department to have lectures about trauma, to find out what's going on in their body. And I was, as you said, I'm still here, I'm still now, a TRE provider, which is trauma tension release exercise. So it's a body-centered activity that is a breakthrough in the stress management and in releasing trauma stored in our body. So it was educational one side, and the other side was somatic treatments.
Perfect.
Yeah.
Okay. And so today you're going to talk to us about trauma, correct?
Yeah.
Okay.
And I just want to specify that today I'm not gonna use technical terms, nothing that you cannot already have been heard by other professionals, and or you can just have a research on Google's. But I just want to talk to you about my knowledge about trauma and my experience in the trauma field. Okay, so it will be very easy, very interactive, and if someone else wants to talk, I'm here. I might ask something to someone else, to you or to the audience, and just to make it like a conversation between friends.
Perfect.
Yeah,
That sounds perfect. Yes.
So before I give my definition of trauma, I would like to know, what is your idea around trauma? When you hear this word, what do you think it is? Not complex thing, just easier.
Well, for me as Perry, when you say trauma, the first thing that comes into my mind is childhood. I mean, what I believe in, or what I think, I don't believe in it, but what I think is most people, or whether they are young adults or adults, most of their traumas are traumas from their childhood that they grow up with without dealing with it. So that's why it's connected with me with childhood, or maybe that's my trauma. Yeah.
Yeah. So what do you think it is? Is it tragedy happened in your childhood, is a stressful event happened in your, what is that when you say childhood? Fine, so we define where it happens, but what?
Yes, it could be. To me, it is definitely a stressful event, or a surprise that that my mind as a child could not understand.
Yeah, you're kind of very, very, very close. Yeah, I like
Yeah.
that. Yay. Is there anybody here in the audience?
We do have people in the audience, yes, and we have Muhammad Samir. He says, "Hey." Kamal says hi, and he says that you are amazing. Thank you for being so kind and sharing your experience with everyone. And we have Mayeda. She's responding to your question. She says it's bad past experience.
Right. Is a bad past experience. Yeah. And Ahmed? What about
Muhammad,
Ahmed or Kamal? Kamal is still here with
Kamal,
us?
yes. Yeah, he just dropped a hello, and I believe he's going to his meeting right now.
Okay.
Yeah.
So the reason why I asked about trauma is because people have this distorted idea around it. So trauma, let me give you my definition, is the
Yes,
result
please.
of an overwhelming amount of stress that exceed the person's ability to cope. So it pushed the nervous system beyond its ability to self-regulate. So as I said, that means that trauma is not the event, it's not what happened to you, but the effect left within your internal system, in your physiology, in your emotional and psychological system. Okay, so it is very important that the people think that trauma has been caused by something huge. But what is an event can be traumatic for someone and not traumatic for someone else. It's very, very personal, and it's not about being better, being worse, or being superior, having better abilities. It's just depend on the amount of stress that the nervous system is getting, and then it reaches a peak level where the nervous system cannot deal anymore, and it goes into shutdown, the freeze response. I don't know if you're familiar with the fight and flight and freeze response. Yeah. So just to give you an example, here we have, let's say that we have two people, they are walking on the roads, and they are and they get assaulted and robbed. And then we meet these two people, person A and person B, a couple of days later. One person said that this was a traumatic event. The other person say it was not. Yeah, it was kind of shocking. It was not a nice thing that happened to me, but I'm fine. Okay. So why this difference? So let's rewind and let's go back to their history behind what's going on in their life. So person A, we see that he has a toxic relationship right now. He has issue with the kids at work. The boss is yelling at them, and it was promised, they were promised for a promotion, but they didn't get it, and they are still, but the boss still demands so many things, and they have to overwork. So that person is already stressed. The nervous system of that person is already highly stressed, overstimulated. And when the nervous system is overstimulated, it gets stuck on the on button, which is the alert, the fight and flight response that makes you more reactive and sensitive. So now let's go to person B. history.
Yes.
The person B right now is, we go back and we see, yes, he got some discussion with the spouse, but then they made up and they had a beautiful weekend. They got just recently a promotion at work. So life is kind of smooth. So you can see that the two nervous systems are different. Right now have a different level of charge. One is overcharged, overstimulated. The other one is really regulated. So the event that happened, it can be processed and integrated in the person's system easily, more easily than the other one.
Mm-hmm.
Let's say that the person A not only had this issue with the robbery, but then keeps on having problems at work, at home. So the nervous system can never find a moment to regulate, but instead is stuck on the on button. So is still producing stress hormones, is still dumping cortisol, adrenaline in the body. So the person gets very hypervigilant, or being anxious, or feeling depressed. So that's trauma. And something that's, I want to go back to the original meaning of trauma, which comes from Greek and means injury. And so it's an injury to your nervous system. And from this injury in the nervous system, this will affect your emotional state and the thought pattern around what happened. And coping mechanism like behaviors that are not really resourceful, they become dysfunctional. Okay, I want to define that as an injury, and I want to call it an injury and not a disorder. Because when we say disorder, we are labeling a person that there is something wrong with this people. We are just giving, it's like, so it's an injury to your nervous system. In the other case, let's say that you got an injury in your leg, and for a while you can walk, you need physiotherapy to walk. You don't talk about a leg disorder. You just said that you have an injury to your leg, right? The same in your nervous system. Is an injury that can be healed, or if it's not treated, can get worse. Does it make sense so far?
Yes, so far it does make sense. And actually, I have my uncle says hi, and he's thanking us for this interesting topic. His name is Hatem, and we have Samir. We have Samir, Muhammad Samir. He's asking the loss of a loved one. So I believe he means that could trauma be the loss of a loved one?
Definitely. Of course. Of course. We have in trauma, people think that trauma is a huge event that happened to you. War, terrorist attack, natural disaster, what else? Something, sexual abuse, something super big. So people say like, oh no, those people like veterans, for example, they're coming back from war, for sure they have symptoms of PTSD. But then we have PTSD, but then we have complex trauma. We have big T trauma and little t trauma. So the big T trauma are generally a single incident, which I said the war or this terrorist attack is one event. It's not happening every single day, okay? And then this can cause the symptoms of what is called then PTSD, which I would call PTSI injury. And then we have the little t. The little t are all those highly distressing events that affect the individual on the personal level. So that can be emotional abuse, neglect, abandonment, loss of significant relationship. So when we break up in a relationship, we think that's nothing, that's a trauma. That's a little incident, but is affecting us, is an injury, okay? And harassment, bullied, failure exposure, okay? All experience, all these events really causes significant damage to the person, to the point that, especially if they are repeated, they are happening simultaneously and over. So now studies, they find out that right now the damage caused, the repeated exposure to this little T trauma, it's more harmful and damage and gets more emotional damage in the person than the big T trauma. First of all, because we undermine them. Let's say a little child gets emotional abuse at home. There is domestic violence. The parents are I don't know, they are violent, let's say. I don't want to use anything that is too triggering for someone, okay? Bad situation at home, and then this little child is bullied all the time. Can you imagine? This will change. Not only the person will start adopting dysfunctional coping behavior, but then it will start creating limiting beliefs around the self, the other, and the world. Imagine this little child that doesn't feel loved, cared from the parents, that doesn't feel the attention. That on the other way, if he's a little child, he needs to be a boy. Boy, don't cry. Boys don't cry. Boys don't show emotions. Or the little girl, they have to accept and be nice all the time. So imagine how this can affect the vision of the child around love and trust, acceptance. You know, so I reply to the question of your uncle. Yes, the loss of a loved one is a trauma. In this case, the loss of the loved is, if it's death, generally it belongs to the big T trauma. So it is a trauma. And I can tell you that I will say something that maybe will be too strong, but we are living in the most traumatized society ever in the planet. I mean, if you think about, if we talk about the situation that can happen in your childhood, I'm sure that in other centuries they were roughly the same. But now what we are adding is the fact that we are bombarded by news 24/7, where the underneath message is the world is not a safe place. People are mean. Be careful, you're not safe. Imagine your nervous system, how does perceive this subliminal message every single day. It's already, you are overstimulated. So then we have these people. Did you notice that we all look like we are angry? The people go to drive, and it's like that's the moment that their demons come out, like they are so mad. They are trying to throw their frustration, their life into someone else that just pass, right? Does it make sense? Can you
Perfect
relate to that?
sense. Yes, yes, of course.
Yeah. So imagine that we have all this overstimulated nervous system that made us overreactive and sensitive. So again, when the people undermines the feeling that you are having because they break up, for example, in a relationship, or because they failed in an exam, for someone can be traumatic, because the idea that they built inside themselves is that they are a failure, and that is the proof, is another little trauma adding to what they already have, they already carry with them. Is it clear? Any questions?
Yes, it is clear. And yes, we do have a question. The question is how to heal personal traumas in points, please.
Okay. As I said, trauma starts from your nervous system. Okay, an overstimulated nervous system that is keeps on getting overstimulated by the society and by the life that we are just living. Okay, so healing by yourself, I can tell you from my personal experience, is very, very difficult. You always need a professional. So there are different type of approaches. There are like the cognitive one. So when I talk about the cognitive, is like the talk therapy. Okay, we have the CBT, DBT, cognitive behavioral therapy. So they try to reprogram your mind, your thought patterns, your behavior patterns, in order to replace them with more functional one. Or they're the somatic experience, like Peter Levine, and this is what I do with TRE, which is about releasing. Remember, that is in our nervous system. So what happened in our nervous system is that the body is still in alert, is still in fight and flight, is still looking for a threat somewhere. Okay, so then there is the somatic approach. There is the spiritual one. A lot of people start a spiritual path. It can be a religious path, or it can be just a spiritual path. So a way there, in my opinion, all the 4 aspects of the humans should be treated to have a holistic and organic recovery. So generally, I would say that whatever they do is about releasing the emotional charge attached to the events, and also the emotional charge built on the belief that you created. So it is a loop. Imagine like you don't feel accepted. So you have like, you are a child, you don't feel accepted here by your parents, and they're telling you that you're not good. In order to be good, you need to do that. So you start believing that the way you are is not okay. I need to change. I need to be as they want me to be. So then I keep on telling myself I'm not okay. I am not okay. I have to push away the way I am because I won't be accepted. So and then this personal talk creates and feeds the emotional charge. So it's about removing this emotional charge, replacing the limiting beliefs that it was created at that time, and finding meaning. Finding meaning to what happened to you. Through this meaning, then you move on, you can totally change, or you can find skills that you didn't have before the traumatic events. Okay, there are so many people that what happened to them helped them to help other people. So starting in them like a change, a shift, where they gave a new purpose to their lives. So obviously we are not talking that everybody now has to find a super beautiful purpose in life, like helping all the time, but you know, it makes you more aware about other people, it makes you more compassionate about other people. And so I don't know if I answered to, I don't know who was asking me the question. Healing, overcome through a professional, and I suggest always to touch the 4 aspects of the individual. So cognitive, emotional, spiritual, and somatic.
Perfect. I believe that this question was answered perfectly. And we have another one. Can we say that one of the reasons for trauma is denial?
One of the reasons is denial. What's denial of being traumatized?
Like, could denial be a main reason why a person is traumatized?
Well, denial about their own, I mean, people would think to be okay, but they are not okay, something like that. Well, I think that in that case, that is a coping mechanism. They are trying to put like a wall to their pain, to the pain that they are feeling. So they are trying not to feel anything by saying like, not that it didn't happen anything to me. So when someone is in denial, it means that it's traumatized. So it's not the reason for trauma, but it is but it gives you a good insight that the person is traumatized. Because as I said, trauma is whatever we experience that is less than nurturing in our childhood, okay? So it starts with childhood. So many people, I've been treated so many people that at first they were in denial. They were saying, I don't have any issue. I'm just an addict. I don't have any trauma. Well, addiction, it doesn't come from out of the blue. You start forcing yourself to use substances or behaviors or anything that, or a process, because you want to mitigate a pain that you had inside. So if it was not for this pain, you just don't start being an addict. I was saying, you just don't start being an addict just because, you know, that's cool. You are saying that your life is going down and you keep on saying that that's cool. You're just numbing. So it comes from trauma. And these people in the first, they were just in denial and saying, no, nothing happened to me. And then when they start opening up, the most hurtful things were happening to them. It's like it was really painful to hear their story, really painful. So, but they do have this armor, you know? So I hope I answered. Denial is not trauma, but it gives you the insight that that person is traumatized. The fact that is in denial, because we all experience little t trauma, at least little t trauma.
Perfect. Okay, and is it harder to treat traumas that have been caused during childhood, or traumas that were caused during adulthood? Which one is harder to treat, and why?
The most difficult is developmental trauma, which is what happened to you that is caused by neglect, abuse, and abandonment within the first 3 years of the child's life. In that case, a lot of cognitive, neurological patterns, they are disrupted. And also the type of attachment that the child then develop is totally disrupted. So that is the most difficult, because when they made a scan to the brain, they realized that they do have a lot of issue in their brain, and again, it's not a disorder, it's still an injury. Okay, a child that it was exposed very early and is in their life to trauma. Okay, but so obviously the younger the person was when he was experiencing traumatic stressful events, the more difficult it was for their little nervous system to deal with the thing, no? And it was the moment that they start imprinting their identity. You know, their identity is based on what is happening to them in that time. And even though then they become adults, they are still carrying that imprinting, you know. They identify themselves with those trauma. A lot of people, for example, I want to tell you something, identify themselves with their story. So for them, tell them to change their story is about to destroy their identity. Who am I? I'm a traumatized person. I've been always thinking that I am a victim of abuse, of domestic violence in my house. So if you remove from me my story, who am I? What should I write about myself? So they are attached to their trauma. This is called trauma bonding. Okay, then we create with someone else, and then in the relationship with someone else, we try to, the adult wants to try to relive the same situation he was living when he was a child. You might say, how is it possible? It's not doing consciously. Unconsciously, it's choosing the person that represent or the mother or the father. You know, so I would say that it's difficult. Complex trauma is more difficult to treat than the PTSD. PTSD, as I said, is a single incident. You've been witnessing a terrorist attack. Okay, it's a single incident. So now you have the symptoms of PTSD, which are specific, like flashback, nightmares, avoidance, and then you startle very easily, or you feel depressed, no joy in life. Those are the symptoms of PTSD. But complex trauma shaped your personality. I don't know if you get the difference between the single incident and the complex trauma. So and in adulthood, it's, if something happening, obviously it's easier because you have more resource, you have experience, you have more resources than a child, a 6-year-old child. What kind of resources does he have if the only person who he loves are treating him not nicely? What resources? What can he do? Can he walk away? No. Does he know how the world works? No. So less resources when it was a child. When in childhood, it means more traumatized the person is in adulthood.
Okay, thank you very much for that. And I have another question. Can a person that suffers from a certain trauma, and يعني whether it's a childhood trauma or a trauma that happened during adulthood or whatnot, to cause that person to be a toxic person in a relationship, or another side to the question is a person who is traumatized, can that person be an attraction to toxic relationships?
Of course. And that's my specialization as a coach, is codependency recovery, because childhood, especially childhood trauma, will cause you a disconnection to your real self. By causing this disconnection to your real self, then you don't know who you are. You have a very low self-esteem, and you don't have boundaries. You are a people pleaser, generally people pleaser, or trying to help so much, and they don't know how to, they try to control in order to feel safe. So generally these people attract narcissists. So they go into a toxic relationship because, as I said, they will relive the same situation they were living when they were children. So same. So, and the narcissistic is a person that is a codependent as well. It's called codependency when you have this disconnection with the self, low self-esteem, but it's manifesting on the other extreme. So it's trying to hide the low self-esteem and self-worthiness that he has about himself by showing who is not, by not feeling by, and generally the narcissists attract a codependent because the narcissists really need the approval of someone else, the approval, the validation, this veneration done by someone else. And the codependent is the one that is turn her life or his life around someone else because doesn't feel to have self-worth or self-esteem, no boundaries. So his or her life gets significant with someone else, through someone else. Is it kind of clear? So yes, they do create toxic relationship. They do stay in toxic relationship.
Yes, that answered the question perfectly. Thank you.
You're welcome.
Okay.
Any question? I can't see the audience. I'm sorry that I can't see it.
Actually, so far we don't have any questions on this part. So what else would you like to tell us, Letitia, about trauma and PTSD? I mean, are there ways that a traumatized person can manage not to traumatize another person by their traumas, or to teach themselves how to work with their traumas, not against it, so that they wouldn't affect their work or their love life or their relationship with their families or friends and so on?
Well, imagine that, unfortunately, we are still surrounded by people that think that looking for a psychologist for help is a weakness. It's kind of saying that they are not okay with their minds. There is something wrong with them. So this adds more limiting beliefs. So it's kind of difficult for these people to just accept accept that they do need help, you know. And then there is this misconception that since they don't believe that they have a problem, I mean, I'm not talking about disorder, but they do have, they are not, they're kind of unresourceful. Their behaviors is becoming unresourceful, not only for them, but also for other people. They think that I don't want to pay someone so much for healing that, for helping that. I can do it. I'm okay. I don't have any issue. So, and I don't want to really make a generalization. And I'm saying this is a generalization, obviously, okay? So please, to the audience, don't take it personally, but generally, especially for men to admit that they do have emotional issue, it's an issue already, okay? Because they are not in touch with their emotions. They try to keep them always at bay, not dealing with them. They try to override the emotions with the intellect, with the intellectualization, and they don't want to deal with it, with the emotions, because it's too much, because they've been trained when they were children that emotions belongs to girls, not to them. But I mean, which is the wrong concept, because we have the, you know, in all of us, we have this feminine part and the masculine part, and the two of them, we need the two of them, okay, both balanced. So maybe we might have, when we talk about alpha men, because many, it might have more the masculine parts dominating, but still it will have the emotional side. So I don't know how, it's a difficult, it's a tough thing right now, unless slowly, you know, they are right now, in some school, they are adding meditation, they're introducing meditation. And that's very cool, because they are like just saying this is not about feeding you with cognitive information, but it's also about educating you regarding emotions, because you do have emotions. So that's cool, because the new generation will be more in touch with the emotions. Little boy and little girl as well.
Okay, thank you very much for that.
You're welcome. Do we have someone who is a woman?
We do. We had a woman, yes, she was with us. I don't know if she's still here or not. I can't say, but yes, we do have a woman that is live with us, and I would just like her to comment to see that if she's active or not.
Okay. Yeah. Now, just to ask, from a woman, her experience in your relationship, like we struggle generally, we as women, we struggle in relationship, but just because we come from a background where we are belittled a little bit, so we generally we have a low self-esteem at first, in the, I mean, especially in the first experiences. Then we get more wise, we get wiser, and we adjust them. But in the first experience, we are a little bit more, we get more into toxic relationship. Yeah.
I believe that women who are young and still experiencing like their that side of them, that side of being, going from a girl into a woman and experiencing a first relationship with a guy that she likes, and she thinks is the love of her life at the age of 16 or 18. Yes. So actually, at that age, I believe that these women, these young ladies and beautiful women, are full of energy, full of love to give, and full of emotional power to give. So they end up spoiling that person, and usually they fall for a guy that is like 5 or 6 years older. So they start spilling these emotions, and then the guy gets like egoistic, and he becomes so arrogant, and he's like, oh my god, she cannot survive without me right now. And then this is where he starts abusing her emotions and her good intentions into like destroying her self-image and self-esteem, and how she loves herself and loves everyone around her, and he turns it into like, let me put it in an example. If she's like a blossoming flower, by the end of this relationship she will be like a dead leaf.
Mm. Yeah.
Yes.
But yeah, a journey comes from the idea. I mean, if the girl started to with this relationship and to give everything to the guy, it was because she came from this idea that her role in society is this. Her life is about having a man. And so she makes her life surrounded around this idea of this Prince Charming that never happened. And so it's already a person that has a poor connection with herself and a poor esteem of herself without a man, without a guy. Does it make sense? It's already her thinking that my life will be complete if I have someone else, if I have a man next to me. For men is on the other side, that is like, okay, I will need sooner or later to have a wife, but it's not, I'm not creating my life around that. And that is another type of trauma for ladies. For men is another, for men is more like the loss of prestige or not being bullied. They suffer more for being bullied more than us. And this competition, this judgment, this need to be always up, always better. So is another type of trauma. They suffer of another type of trauma. And imagine that is a society that is built up on trauma. That's why I was saying that we are built up because we do not connect, we are not connected to ourselves, to our authentic self. We just wear masks. Those masks are generally our little t trauma.
And I have another question as well. Like you mentioned earlier that when a person is traumatized and they get emotionally attached to their trauma, and it becomes their story and whatnot, and once they start working on this trauma, they believe that they start losing their identity because
Right.
their identity revolves around the trauma. So how can a person like go in search for themselves again? Are there like exercises that a person can do, or something that they can work on before seeking professional help?
Well, exercise that they can do. Well, I suggest something that to remember how they were when they were kids. like to remember what they liked, what was their passion, how did they enjoy their time. So it's just to connect, but so many people have forgotten, and they really believe that the story is them. It's not anything else, because they delete it. Since it was not acceptable to be authentic, they tried to delete it, but it's not deleted. It's still in the subconscious. In the conscious mind, it's not there anymore, but in the subconscious, it's still there. So that's why I said that without the therapeutic help, it would be a little bit more difficult. And then it will take practice. And you know, the therapy help you to be accountable. If you do it on your own, if you need to practice on your own, but you're not accountable to anybody, after 3-4 days, you will give up, because there is nobody that will ask you, have you done the exercises? Let me show me the exercises. Tell me about it. Have you done your journaling? So then you will lose, because life happens to us, and then you will lose the first motivation that was there to do this work, and then you forget about it. So the therapy, I'm not inviting for the therapy, but I'm saying that we always need someone to be accountable to. And so the exercise that you can do is meditation, for sure. Meditation helps a lot, but I would be careful to say meditation, because with people who suffer of anxiety, meditation can be a place where they will cause more anxiety, because they are restless. They can't stay quiet. They can't stay still. So it's not effective for people who suffer of anxiety. And so in that case, meditation is not okay. A good thing that another exercise, it can be at looking at what triggers you. So all those situations that triggers you, like I notice, so that means a lot of self-observation, being mindful. Mindful means you are in the here and now, you are present. The only way to understand what's going on within yourself is to be present. And you will realize that you will get the information from your nervous system. So you are getting into a room and you start feeling your heartbeat racing. And then a second later, an emotion will show up. Why? What happens? What is triggering me? I feel anxious right now. Why? Because this person makes me feel. Why? Why this person makes me feel? Because he makes me feel that I'm not capable of doing something. Okay. Why do I have this fear? So it's a lot of why. It's a lot of self-observation and self-building, self-awareness. So mindfulness. So if you cannot do meditation, at least mindfulness. But so in that case, at least try to do some course of mindfulness, because in the beginning, super difficult. With our monkey mind that goes from one branch to another branch with the thoughts they are running, it's quite difficult. Or you can do it for a minute, and then the monkey mind is already there. So self-awareness, self-observation for sure, and noticing what triggers you. And then journaling. And if you are ahead, if you get advanced, then trying to stop the trigger. So this situation triggers me. How can I relax my nervous system? Take a deep breath. Go back to my body. Notice what's going on in the room. So that is the way to bring the nervous system from a stimulated state to the parasympathetic, which is the calm way. Then the cognitive part of the brain will get engaged, and you are not in survival mode anymore. But I don't know, it might be too technical. I hope it's kind of easy to follow.
Well, as for the journaling and meditation, yes, that's I think most of the people would be able to do it. As for the triggers and the mindfulness, no, definitely it would need to be supervised, because it's definitely not easy. I mean, the steps into going into mindfulness, you would have to understand wellness and self-awareness and your self-image and all of that. It's all connected at the end of the day. So
Right.
yeah. Yes.
And
Okay,
that's why I was saying you need the help. It's not something that you can do on your own.
true. We have a question. So what can a person do to aid someone who has a trauma, and what are things like behaviors that a person with trauma exhibit?
It depends. It depends if it's a PTSD. So the symptoms of PTSD is about, as I said, a flashback, nightmares, bad thoughts, or avoidance. Generally, a person try to avoid any feelings, any place associated to the event. Okay, and then it can be this mood, which is or depressed, no joy in life, and not, or the other one is hypervigilant, anxious, okay, or easily startled, means like feeling like in an impending doom. So all those are symptoms of numbing, depression. These are all that, and generally who suffer of PTSD generally goes into substance abuse or process abuse, okay, which is like gambling or sex or whatever, in order to numb, you know. So if you are next to a traumatized person, you can help, yes and not. Yes and not, because you need to remember that you are a person too. And it's not about, I get it, to help. It's okay to be, to have empathy, but with empathy, we risk to burn out. So we always need to keep our boundaries really set and say, like, I offer my help, but if this person doesn't want to be helped, and generally they don't, because they don't think to be, or they just use the story, I have trauma, I'm like this because I'm traumatized, so you need to accept that I'm like this, and which makes, says, no, help yourself. It's the other way around. Help yourself. You can change your story, but not by deleting it. Again, not deleting it, it's releasing this emotional charge that you have around what happened to you in your life. So always keep your boundaries, love yourself first, and then you can help or give your hand to someone else if they accept it. If they don't accept it, just go back. Okay, I hope I don't sound cruel, but
no, not at all.
It's like with oxygen mask, you know, in the airplane. They always say, wear it first and then help others that need your help. But first, you need to help yourself. So never burn out for someone else that is not accepting or is not appreciating your help. It's better to have someone else, an external person, to help this person.
Perfect. Thank you very much. Well, actually, I can't believe that like we're almost up with the time, and I myself have benefited from this discussion very, very much. It helped me realize a lot of things. And definitely I'll be journaling about it. Um, and I just want to ask you, is there anything else that you would like to advise our viewers with?
With seek for help if you feel that you are living in survival mode, that you can't find a reason, a purpose, a mission in your life. Seek for help, because probably there are so many parts of you that are looking for help. And so that, and then be kind to yourself. Listen to what you say to yourself, to your inner dialogue, because the worst enemy are not the others, is always you. So be kind to yourself, seek for help if you need it.
Thank you so much, Letitia, and this has been really, really wonderful. Thank you very much for giving us your time and your knowledge, and really, really looking forward so that we can work together again very soon.
Thank you so much. Thank to you for this opportunity. I hope that I clarify something to the audience, and thank you so much for this opportunity.
You're welcome. And if I may add to all our viewers, if you guys have further questions and you would like to connect with Letitia, she will leave her contact details so that you would be able to get in touch with her whenever.
Yep, for sure.
Okay.
Thank you so much.
Right. Thank you so much and have a lovely evening.
And you too.
Thank you.
Bye.
Bye.